lot of clients will come in and they'll complain of pain shooting down the leg, and they'll stand there and tell you point blank it starts right about here and it comes out and it works its way down the side of the leg. If it's coming down the side of the leg, let's not really actually go for the whole idea that it could be piriformis syndrome. You could be talking about IT band or a lot of other issues beyond that. If it goes directly straight down the back of the leg, if there's a numb feeling in the back of the hamstrings, it could pass the knee, it could shoot down beyond the hamstrings and start at the calf. It could come up from the bottom of the foot, work its way up back to the glutes. It's very tricky when it comes to sciatic issues. But if it's straight down the back of the leg, through the hamstrings, through the calf, then you definitely possibly have an issue there with compression on the side. With the sciatica issue, you're going to have to test everything to get a really good evaluation of whether or not it could possibly be, no diagnosis, but an assessment, sciatica. From the glutes, the hamstrings, the quads, calves, you're going to have to test it all. So what we're going to do is we're going to start testing the number one muscle, the piriformis. I'm going to have Nicole lie face down for me, please, with her face in the face cradle. We'll just take an assumption that we're going to work with the left glute. Relax. Bring her leg out just slightly. We're going to have her push against our hand. We're going to have her, nope, she bring it in laterally, medial, towards the inside of the body. As she brings her foot, if there's any pain here, I'm pulling back, I'm resisting her. If there's any pain here, we're tensing her piriformis. It's definitely an indicator that there's some issue going on with the piriformis, okay? If there's issues with the piriformis and the sciatic nerve run side by side. If you can look at your last page, always have your client take a breath in, relax. As they exhale, apply more pressure. Your client relaxes, the muscles relax. You can go further with the stretch. Ideally, okay, look at where her knee is. Okay, this stretch, this is a low back stretch. Relax the leg. Take the piriformis towards laterally to the outside. Bring the leg back across, deep breath in. Relax. At this stretch here, which is going to be a lot harder because we're actually